How do you fix a lifelong iron deficiency in 2 months? Well, today you're going to learn how a patient accomplished this and restored her health by healing her gut. And if you find this information helpful, please like and subscribe so more people can see this video. My name is Dr. Tom Rofrano from the Natural Medicine Clinic in Palm Beach Gardens, Florida, and author of The Free Diet. And I had a patient come in, a 55-year-old woman with anemia that she's had for as long as she can remember, and the associated symptoms of fatigue, brain fog, poor memory, headaches, vertigo, depression, anxiety, insomnia, hair loss, dry itchy skin, joint pain, abdominal pain, bloating, constipation, gas, difficulty losing weight, and many other symptoms. She was prescribed iron supplements over the years, even had iron infusions, and here she's still dealing with this and feeling terrible. So the first step is to get the proper testing. I ran a comprehensive health panel and indicated that she had below optimal iron saturation, ferritin, but it was within the normal range. So at first glance, everything looks fine. However, there's a big difference between normal and optimal. For instance, this lab indicated normal for ferritin was 10 to 232, and she was 14 at the very low end of normal. Same thing with her iron, her saturation. Optimal ranges for ferritin are approximately 50 to 80 depending on the person and other factors, and below 40 you can get a lot of the same symptoms that she was having. So because her labs looked normal, her doctors couldn't figure out why she was feeling so terrible. So I like to look at functional testing that determines root causes. And for low ferritin and iron deficiency, typically it's related to gut health. So she tested positive for gluten sensitivity and celiac genetics. This can cause leaky gut, which she had, and malabsorption, and lead to other food reactions, which she was sensitive to other foods, causing more gut inflammation and malabsorption. She also had gut infections, candida yeast and bacterial overgrowth, and all this can lead to other deficiencies. She was low or below optimal in vitamin D, magnesium, B12, zinc, and she also had below optimal adrenal and thyroid function, even though she was on thyroid medication. And this was causing an autoimmune condition as her ANA marker was very high. So having chronically low ferritin can indicate a lot more than just an iron deficiency. Oftentimes there's so many other things going on that need to be addressed in order to restore your health. And it usually revolves around the gut. So I put her on an anti-inflammatory diet I call the Free Diet, and the proper supplements, which I'll go over with you shortly. And the end result was at 2 months, her ferritin went up over 300%. To optimal levels, as did her iron and saturation, magnesium, B12, vitamin D, all normal. At 3 months, she continued to improve, and her autoimmune marker was normal at this point. She was feeling like a new person, with the following symptoms being better: fatigue, brain fog, headaches, vertigo, depression, anxiety, insomnia, hair loss, joint pain, abdominal pain, bloating, constipation, and she dropped 20 pounds in 3 months, achieving her desired weight. So how she achieved this was with the Free Diet. It's a diet I came up with years ago when I was discovering how to heal my own autoimmune Hashimoto's and rheumatoid condition, IBS, fatigue, skin, and other chronic health issues. I was able to get better and have helped many others do the same. It's a diet that's free of not only gluten, but gluten, grain, sugar, yeast, dairy, eggs, soy, legumes, nightshades, processed foods, all those foods most commonly responsible for inflammation, gut, thyroid, and other chronic health issues. That's phase 1 of the diet. And in phase 2, as you're getting better, you start adding back additional foods to see how you do. I'll put a link below for the Free Diet phase 1 food chart that we'd be happy to send you. And I'll put a video at the end of this one that goes into the diet in more detail. And I put her on the proper supplements. Instead of only giving her iron, I had her take what I call the functional 5, which is multi-fish oil, vitamin D with K, magnesium, probiotic, other gut supportive supplements like Yeast Defeat, Curcumin Protect, DHEA for her adrenal dysfunction, and B12, zinc, vitamin C with iron. And the iron I use is iron glycinate. I find that works the best. And I had her take 4 a day, which was approximately 120 milligrams. And then as your levels get up to optimal levels, you adjust the dosage accordingly to make sure your iron doesn't go too high. So that's how she was able to resolve her iron deficiency that she had for decades and clear up her fatigue, brain fog, gut symptoms, and feel the best she has in years. So if you have chronic gut, thyroid or ferritin issues. It's important to get the proper testing first, because if you find out the root causes and are provided the right solutions, I believe almost anyone can get better. I'll put a video that goes into the free diet in more detail here, the free diet phase 1 food chart below. Feel free to like and subscribe so more people can see this video, and I'll see you next time.